All right. So my name is Modupeola Adebayo. I actually go by Ola, and I'm a clinical assistant professor at Georgia University here in Atlanta, Georgia, USA. Uh, I've been a nurse for 16 years, about, yeah, 16 years now, and my area of specialization is informatics. But I've also practiced, at the bedside before I moved into academia, where I now work full time in academia. But I still do some other consulting work, especially with regards to electronic medical record system. So with that being said, I will go ahead and share my screen again and share my screen so we can do this. I'm not sure if it's been shared. Okay. All right, so again, my presentation is on perspectives of nursing students who volunteered in the COVID-19 screening of on-campus attendees. And the purpose of this presentation, or really the work, is to identify the perceptions of the nursing students who participated in the COVID-19 screening of students who were attending in-person classes during the of the COVID-19 era back in 2020, in the fall of 2020. And also we want to determine exactly how the students view their participation, in terms of their assessment and their communications. So really the problem occurred when we were all hit by COVID-19 mid semester in the spring of 2020. So a lot of adjustments were being implemented. As a matter of fact, several of us faculty here at Georgia State and in similar institutions, we all had to move all of our courses, the inpatient courses, the in-person courses, we had to move them into online or virtual modalities. And so this continued right into the summer semester as well. And then by the time school opened in the fall of 2020, the school, the university made the decision to to start bringing students back on campus. So at that time, there were like three modalities that were presented to the faculty with regards to the instructions. So you could bring your students in, online. You could still continue the online, or you could do what we call hybrid, or you can do the face-to-face. So with the face-to-face instructions, there was designated, classrooms or designated auditoriums that were being used. Can you, everybody with me?
Yes.
Okay, yeah, because the size of the nursing students here usually will be between 40 to like 68 or up to 70 at times. So bringing them on campus means that we need to really observe the COVID-19 guidelines. And so that made us, that got us thinking, as to how we will bring the students in and also be able to prevent the spread of COVID. So, and again, another problem or another issue that was facing the nursing faculty, as a matter of fact, the school at the time, was the clinical placements. Clinical placements were being almost limited only to students who were in their senior practicum. So a lot of the students still cannot return to hospital settings for their clinical rotation. So we were left to start thinking of ways to get the students, to expose the students to clinical, to clinical training, and at the same time observe the COVID-19 guidelines. So at that point, something occurred to myself, and I pulled another instructor who happened to be the course coordinator for the community health course. So So I actually approached her and said, why don't we, since the requirement is to bring the students in on campus, and also we were to bring them in at least 25% of the time. So which means for the 16 weeks duration, we should bring our students in at least 4 times. So which is approximately 25% of the, of the period of the time. So I approached her and I said, well, since we as faculty are expected to screen the patient, I said patients, well, they were our patients. So to screen the students that are coming in for the courses. And we are also to do what we call sitting charts, which is for contact tracing. So, and on top of that, prepare your lesson plans and also deliver your lecture at the same time. So we said, and so I said to her, well, the community health students, if we can get them to volunteer to to screen their colleagues who are coming in for who are coming into for their lectures, if we can get them to volunteer to do the screening, so we can concentrate on the on delivering the lectures. And so that was how that idea was born. So quickly, I wanted to look at some of the literature out there regarding how different groups or institutions or organizations adjusted to the impact of COVID-19. So one of the researchers, or one of the write-up that I came across was by Desai. She said, and she basically was looking from the perspective of, how can we help the students, to deal with the stress of social distancing restrictions, which is the result of COVID-19. So she explained that when faculty implement modalities to replace face-to-face clinical requirements, that we will be encouraging our teamwork in our students, and we also will be able to establish opportunities for the students to kind of minimize stress in their in their lives. Then another group of authors also stated that that one of the impacts of the of COVID, which again is for us to it brought more limelight or attention to infection prevention protocols, because prior to COVID, students will come into the classroom setting. They sit, or they take their seats without even worrying about wiping the seats down. But after the COVID hits, we we started practicing more infection prevention protocols, such as even before the students goes in now into the classroom, we will hand them like a piece of antibacterial wipe to wipe down their seats and their tables. So this kind of help us to practice more infection prevention methods. Then another write-up by Hill and Fitzgerald is actually a study by Hill and Fitzgerald. They recommend a hybrid learning environment to foster student engagement. And so their emphasis is more on using online classroom collaborations and to kind of engage students, even though it's virtual, but it engages the students through discussions online and using Blackboard Collaborate. Likewise, Carolan and Davis and et al. Advised that bringing in students in small groups will facilitate clinical education and also will help to train our students on how best to observe the social distancing guidelines as well. And typically, the other two literature or the information out there also, to summarize those, emphasizes that the expansion of nursing programs must include more clinical placement in ambulatory care type, so that we can increase the demands of for nurses in the clinic and in such settings. Really, when we did what we did, it's mainly to expose the students to more of an ambulatory type setting, so that students are more prepared to go into those fields, of practice, instead of instead of us pushing acute care all the time. This is not to say that we shouldn't push acute care, but then we should also push ambulatory care as well. All right, so this is what the setting where the where the work occurred. So we had, as I mentioned earlier, we had students in the community health course. We asked them to volunteer. About a total of between 25 to up to 28 students volunteered. The class size was for the community health student was 42. So we had like about more than half of them, volunteering to participate in screening their, the colleagues who are coming in for lectures. So as I said earlier, large classrooms or large auditoriums were used as classrooms. There were like two entrances to the auditorium. So tables were placed at each of these entrances, and 6 students were assigned to participate per session. So out of the 25, each session, which means for each classroom session, 6 students were assigned to do the COVID training and to do, to complete the process. And we had a total of 13 sessions in all. So the 2 students that were assigned to each table, one of them was managing the lines, because we needed to ensure that the 6, the separation, the 6 feet separation between, between 2 people or 2 persons were observed. Also, one of those students, the other student was doing the screening itself. So the other student doing the screening will review the information on the screening form, and at the end of this slide, I will show a sample of the screening form. So the screening form was to be downloaded by the attendees. So so once it's been downloaded, they were to review the questions and complete it and bring it with them when they come for their classes. And so the screener, or the person who is screening will review, just go over the questions again with them to ensure that the entries were what they wanted to be recorded. And also then the screener would take the body temperature, record the body temperature, and also pass the paper to the person who will now check the information, check the name on the form with the class roll to make sure that the student who is being screened is included in the class roll. And then with regards to the student chart, one student was positioned inside of the classroom to draw the with a drawing of the seats in the classroom, and the student, he or she, will put the name, the initial of the person who is seated on each seat on that drawing. And this is for contact tracing in case something happened and we need to know who sat where. So to summarize the setup, so the line manager was the one managing the lines, making sure that it's 6 feet, the social, the distancing, the social, the distancing was observed. Also, the line manager also helped to check if the attendee already completed the form or not. But if they didn't, we also had extra forms on the table. So he or she will hand that over to the attendee to complete, while they were waiting in line. Then, as I explained earlier, the screener was taking the blood temperature, the body temperature. I'm sorry, not blood temperature. The body temperature, the temporal body temperature. Then also he or she was reviewing the responses in the form and making sure that that the responses were accurate representation of what the attendee wanted to be recorded. Then the identity verifier again was verifying the information on the form with the class roll to make sure that the person on the class that the person who is attending is indeed on the class roll. And then with the sitting the person who was charting the sitting arrangements, who was, as I said, was positioned in the auditorium and was doing exactly that. And we maintain strict infection prevention protocol all throughout. As soon as as an attendee is being screened, before they proceed into the classroom, we'll hand them an antibacterial wipe to wipe down their table, to wipe down their seats and also their table before they actually position themselves inside, on the seat. And we also ensure that they all had their masks on. Then, so after the session, Dr. Kuykendall, that's the coordinator for the community health course, and I decided to pull the students to get their understanding or to get their perspective or their feedback on exactly how beneficial, if they see the exercise to be beneficial or not. So there were 5 questions which the students were pulled on. We used anonymous. We used Qualtrics application to conduct the anonymous survey. So on the question of the reasons why the students volunteered, majority of them said that they did that because they wanted to get hands-on practice on their assessment skills. Remember that we said in the middle of I informed earlier that in the middle of the spring semester of that same year, we had to move all of our instructions online, including their clinical placements, because the hospitals did not allow us to bring the students back into the hospital. So these were students who had like half a semester or even shy of half a semester exposure to clinical settings, and also throughout their summer semester they were not in the clinical environment. They were doing virtual clinicals, so they were very eager. So their response, the response, general response to the question of why they volunteer was that, oh yes, we definitely want to practice our assessment skills, and this was an avenue for us to do so. Then also some of them said that it enabled them to have, the ability to relate in person with their colleagues and to mingle with their colleagues. Then on the question of what they hope to accomplish when with their participation, some of the students said that they really were looking at increasing their assessment skills and their communication skills. One said, well, I was curious about how the school will implement the social distancing guidelines. So that prompted him or her to volunteer to participate. And several of them said, oh, sure, we want to get clinical credit hours for the participation because the clinical credit hours are a requirement of the course itself. So, and then some also said that they wanted to observe in person to observe direct in-person care and how, and how that will benefit them. So then on the question of if the participation met their expectations with regards to the experience that they've gathered, and a lot of them said yes, that it helped them to improve or to increase their the collaboration skills. Others said that carrying out little responsibilities such as just charting the seating arrangements, or something as little as making sure that enough distance is between the people in line, that such little responsibilities made them feel more, make them feel more comfortable with the interpersonal skills, the ability to relate with others. And also, again, some said they wanted to see how GSU, Georgia State University, will implement these social distancing guidelines. And finally, overwhelming majority of the students that were polled said that they would definitely recommend this specific exercise to be repeated in the future. So, and as we all know that COVID-19 has come, I mean, it's really not, I mean, it has not left us, completely. We're having we're having the variants of the COVID-19, and so adjustments will continue to be made to, to kind of keep us safe and to prevent the spread of it. So in conclusion, we're saying that for pre-licensure nursing students, the COVID-19 environment has also forced us as faculty to, to start looking for very creative ways of exposing our students to community type settings, and also to clinic type settings, even outside of clinics. So overall, it has really been a very a very educative experience for us all, and we continue to think of the different ways or the different modalities to adopt to combat the COVID-19 effects and its and the restrictions. So at this point, I'm going to stop. And I'm going to actually let me go back real quick. I wanted to show the form on the so I wanted to show the form, then I'll come back to the questions. Okay, so this is what the form looked like, the screening form. So we had the screening form. The names of the student will be written on top here. The temperature will be recorded, and so will be recorded here. And then this were the questions that the students must answer before they were admitted into the auditorium. And so at this point, I'm going to prompt and just prompt us, or pause and ask if anyone have questions to ask with regards to this. Okay. So, well, I want to take the opportunity to thank everyone, and also to thank the